All right, everybody. I think we're going to get started now. So I'm Fiona Manzer from Healthy Ireland, and I'm really delighted to welcome you all here today for the launch of the 2023 Healthy Ireland survey. Wonderful to see so many people, and you know, we're not taking this for granted anymore, I suppose, in the context of after the pandemic. So really great to be doing in-person launches and to be able to see so many people. Welcome also to all of you that are watching this on YouTube or the broadcast channels. It's really great to have so many people with an interest in the survey and our health data. So just to say as well, as this is a hybrid event, just to share with you that the occasion is going to be, or the presentations anyway, are going to be recorded, so just so that you're all aware of that. Just before we start, a few housekeeping items, so just to let people know that we're really hoping there isn't a fire alarm, but just in the case of emergency, there are exits there and to the back here, should the fire alarms go off, and the assembly point is the nearest corner of Merrion Square. So for anybody who'd like their teas, coffees and snacks available during the breaks, we'll have our first three speakers first, and then basically we have a 5-minute break then just to allow the ministers to get back to urgent oil business. So just so that you're aware that that's the schedule. In addition to providing us with updated information on health and wellbeing, the survey in recent years has also provided this really valuable snapshot of how we've been doing in terms of, we have data from before the pandemic, because the survey started in 2015 and was run every year up to 2019. We had to take a wee break to switch around the methodology and to start doing the interviewing by phone in the context of the pandemic restrictions. And we're still doing the survey by phone now because it has certain advantages. It's reaching a lot of young people, for example, and there are a few other ways in which we found that this has really been working for us. But just to be aware that the first 5 years of the survey were done by personal interview and the subsequent 3 were done by phone. So just so that there are some slight differences there in terms of what we can do with it. Supporting health and wellbeing has never been more important. We are all aware that quitting smoking, drinking less, exercising more and eating healthily can reduce the risks of both non-communicable diseases, but also reduce the risk from infectious disease as well. It means we cope with it better. So our work in Healthy Ireland has never been more important in terms of providing information around how to make positive changes to protect our health and to keep our health and wellbeing as good as possible. So without any further ado, I'm delighted to introduce our first speaker, Minister of State with responsibility for public health, wellbeing and the National Drugs Strategy, Hildegard Naughton-Seedy.
Good morning, everyone. I'm delighted to be here with you this morning and to have the opportunity to address you for the launch of the 9th wave of the annual Healthy Ireland survey. This survey, it's a vital part of the information that we collect on how people across Ireland are doing in terms of their health and their well-being. So every year, the survey asks approximately 7,500 people living across Ireland about their health behaviours, including smoking, alcohol use, diet, and their use of our health services. So we've been running the survey every year since 2015, and the data gathered since then gives us a great opportunity to look at how some key health behaviours are changing over time. The results of the survey enable us to keep an eye on the risks to our health and well-being, and it also tells us to some extent how various Healthy Ireland and other departmental policy initiatives are working on the ground. We can see where things are working well, but also where additional initiatives might be needed. The survey monitors key indicators such as smoking, weight and diet, alcohol consumption and physical activity on a recurring basis, but also has the flexibility to include questions on new and emerging issues. So Kieran will be going through the detailed results of the survey shortly, but before this, I'd like to take the opportunity to comment on a few of the key findings. Previous waves of the survey have shown a steady decrease in the number of people smoking, with the prevalence of smoking dropping from 23% in 2015 to 18% in 2023. Smoking levels are broadly stable. 18% of the population have reported being current smokers in each year since 2021. However, 8% of the population now use e-cigarettes, up from 6% last year. And while e-cigarettes can be a valuable quit aid for smokers, usage rates have risen from that 6% rate last year. So we're progressing the public health, tobacco products and nicotine inhaling products bill through the Houses of the Oireachtas presently. So this bill, it contains wide-ranging measures to tackle smoking and vaping among children and adults, and will prevent the sale of nicotine inhaling products such as e-cigarettes to those under 18, and that should be enacted very shortly. Since the publication of our National Tobacco Control Strategy, Tobacco-Free Ireland in 2013, we continue to work on a range of initiatives to reduce smoking. And as part of Budget 2024, nicotine replacement therapies, NRT, are now included in the drug payment scheme. And €1.1 million has been provided for free NRT through the HSE Quit service, bringing the total funding of €1.8 million in 2024. However, recent findings are a timely reminder to remain vigilant in tackling the challenges posed by nicotine use. And I'm encouraged that in the last year, 49% of those who smoke have tried to quit, and 23% of those who tried to quit succeeded in doing so. The HSE provides a range of supports for those who want to quit, so I would signpost anyone in this position to their quit.ie website for really good resources. With regard to alcohol use, 70% of people have consumed alcohol in the previous 12 months. That's a 5% lower rate than in 2018, and almost a quarter of the population are considered binge drinkers. They drink 6 or more standard drinks on a typical drinking occasion. And while alcohol consumption has risen since the 2021 survey, which was conducted while significant restrictions were in place across the country, I'm happy to report that the figure for binge drinking remains lower than in 2018 at 27%. It remains absolutely critical that we continue to reduce the harm that alcohol can cause in our lives and in our society. And we've made good progress in implementing the Public Health Alcohol Act. The main aims of the Act are to reduce alcohol consumption and the harms caused by alcohol misuse, to delay the age at which children and young people start drinking alcohol, and to regulate its sale and supply. Key measures include minimum unit pricing, regulating advertising and sponsorship, and the display of alcohol products in mixed retail outlets. The Act will also introduce health labelling on alcohol products, starting in May 2026. This year, the Healthy Ireland survey also asked respondents about health messaging and information relating to alcohol that they may have seen on alcohol packaging or alcohol advertising. So this information is being collected ahead of the introduction of the health labelling, and that will again form a basis for assessing the impact of the new health information. For the first time, Healthy Ireland, the survey has asked about prescription and illicit drug use. Of those taking part, 21% of people reported ever using illicit drugs, with 7% using illicit drugs in the last year and 3% in the last month. The most prevalent illicit drugs used within the last year are cannabis, cocaine, and ecstasy. The survey also asked about sedative and tranquilizer use, with 7% reporting use in the last year. Over 90% of those were prescribed. This data is a very welcome addition to the Healthy Ireland data set, and it will certainly inform the ongoing implementation of our national drug strategy. These insights will also assist with our consideration of the final report of the Citizens' Assembly on drug use, which we're expecting over the next few weeks. And I'd just like to finish with a few words of thanks. Firstly, to Ipsos MRBI for all their hard work in completing the survey on our behalf, and also to thank my colleagues in the Department of Health who managed the survey, in particular the Health and Wellbeing Programme and the Statistics and Analytics Unit. I'd also like to thank those colleagues in the department, at the HSE and elsewhere in government and the state agencies who have over the years contributed questions and modules for the survey and helped us to review and present these results. And finally, and most importantly, I'd like to extend a huge word of thanks to all of those many people across all parts of the country who took part in the survey and gave freely of their time and contributed so much to what will be a valuable resource for us in relation to policy and the rollout of supports. Go raibh míle maith againn. Thank you.
Many thanks for being with us today and for that introductory talk. Thank you very much, Minister Naughton. Without further ado now, I'm going to introduce Minister Butler, who's going to talk about the mental health related aspects of the survey. Thank you very much.
Thank you very much, Fiona. Good morning, everybody. Toano, Hasaram Vanshaw, and Majin and you. It's great to be here to celebrate the launch of the 2023 Healthy Ireland survey. One of the key topics supported by the survey since 2016 has been our mental health. And I have to say it's great to have this data. I love data. Dr. Philip Dodd is sitting there in the front row who supports me every week in my work. And data is so important when you're trying to determine policy and you're trying to determine the best direction you can take to support people with ill mental health. To provide a focus on this and on factors that influence it, mental health, social connectedness and suicide awareness were included together in this year's survey, and that's very, very welcome. The COVID-19 pandemic has really highlighted the importance of social connection to our mental health. The good news is that over a third of the population feel that their social connectedness has improved since the 2021 survey, which took place at the height of COVID restrictions on social activity. Over 40% of the population are participating in social groups or clubs, and only 2% say they have nobody close to them that they can count on in times of need. Only 4% report being lonely all of the time, while 10% reporting feeling lonely some of the time. Loneliness is a huge issue. It's one of the issues. You can be on the busiest street in Dublin, you can be living at the butt of the Cumry Mountains in Waterford. It doesn't matter where you live, but there's a lot of people lonely. And whether it's 2% that have nobody, 4% being lonely all of the time, that's still a huge proportion of people, and we need to reach out to them. Research has confirmed the negative impacts of loneliness on mental and physical health and well-being. It is an issue, and we have been focusing on it. Social prescribing, which offers GP and other health professionals a way of referring people to a whole range of community supports and activities to support health, well-being and social connectedness, is now available in all counties in Ireland, including through our Sláinte Care Healthy Communities programme, and this is working really, really well on the ground. Our Hello Again World campaign, launched for the second time this week, encourages older people and others who may have been vulnerable to COVID-19 to re-engage with their communities, hobbies and activities. Now that vaccination campaigns have reduced the risk from social activity, the campaign has been run again currently, and I'm hoping you all saw the adverts on the television this week, and to see that lovely gentleman sitting in his house trying to determine, will I step outside the door or not? Will I re-engage? And it's so important to re-engage. And we've 323 day centres back open the length and breadth of the country. And they're such an important resource for people to take that step outside the door again. Older people became very dependent during COVID on their families and their friends, whether it was to collect the pension, whether it was to do the shopping for them, whether it was to pay a bill. And they are finding it hard to step outside. Some people took that step and they just embraced life again. But I think when you lose 2 or 3 years when you're in your 80s, it's very, very difficult to take that step. And I'd be very conscious of a lot of older people who are finding it difficult. So launching that our Hello Again, that world campaign might be just the impetus that it might support a person might decide to step out again. So programmes such as our Healthy Age Friendly Homes and the HSE's Work With Alone aim to keep older people living independently, yet connected to services and supports, and to remain in their homes for longer. The survey also looked at the nation's mental health scores. Positive mental health scores have decreased significantly when last measured in 2021, which I don't think was a surprise to anyone in the context of COVID. However, similarly, markers of mental health mental ill health had increased during the pandemic, but I'm very happy to report that these scores have improved since the height of the pandemic in 2021. However, our mental health has not yet returned to pre-pandemic levels seen in 2016. Again, I wasn't surprised at that. We've had 33% more referrals into CAMHS, for example, during 2020 and 2021. Like 33% more referrals is absolutely massive. Last year alone, CAMHS teams issued 225,000 appointments to young people the length and breadth of the country. So we can see how the CAMHS teams, all 75 of them, are under pressure with the amount of young people being referred into them. The fact that we have not yet returned to pre-pandemic levels requires continued focus. In addition to the supports provided through our key mental health policy sharing division, we are also drafting a mental health promotion plan to support positive mental health and well-being, and this will be completed within the next few months. Investment in mental health, national clinical programmes and models of care has led to significant service improvements, and these include a specialist perinatal mental health network, an ongoing expansion of specialist teams for eating disorders, counselling services, ADHD and dual diagnosis supports. My department and the National Office for Suicide Prevention welcomed the findings of the online survey, which the module for suicide was included for the third time this year. 69% of respondents know somebody who has died by suicide, 69%. 15% of respondents reporting that someone close to them died in this way. We all know suicide is a very, very complex problem, which has a huge effect on families, on communities. It's an absolutely devastating loss. And addressing suicidal behaviour means supporting people in many different ways. Connecting for Life, Ireland's suicide reduction policy, is in place until 2024, with substantial progress having been made through 22 and 23. Funding is in place to expand the Suicide Bereavement Liaison Officer service delivered on behalf of the National Office for Suicide Prevention. The HSE also fund Pieta's House Suicide Bereavement Liaison Service, and I would recommend anyone who has lost someone close to them by suicide to contact the service. We will continue to do all we can to reduce suicide and incidents of self-harm across Ireland. One life lost is one life too many. People also know that there are many types of support available, and anyone feeling distress or in crisis should contact their GP or mental health services, because recovery is possible. And I suppose that's the key message: recovery is possible. Needless to say, we plan to provide further supports for positive mental health, for mental health services, for social connectedness, and to prevent suicide in years to come. As Minister Naughton also mentioned, I would like to extend a huge thank you to our colleagues in Ipsos Ireland, in the department led by Fiona, and our state agencies who have been working to deliver the survey. I would also like to thank Breda, our CMO, for all her work on this. And I want to thank too the public who kindly agreed to be interviewed to inform our work in this area. Lived experience and people who are prepared to answer a survey and point out the difficulties and the challenges they face every day is very, very important. So thank you very much for your time.
Thank you very much, Minister Butler, for that helpful update on mental health and everything to do with that. And I'd now like to welcome our CMO, Professor Breda Smith, who's going to discuss antibiotic awareness, health service provision, and general health.
Thanks very much, Fiona, and also thank you for all your work on this report. Fiona and all the team have worked really, really hard on this. So good afternoon and welcome, everybody. I'm delighted to see the launch of this report. What does it embody? It embodies data for us. It embodies a snapshot in time of how we're doing as a population and as a society. And that's really important that we have that and we continue to have that, because it enables us to make data-informed decisions. So the survey is a great resource that supports health, well-being and public health in general. And I'm really delighted to be here to discuss the findings. It is a vital source of information for us as policymakers, researchers, and indeed anyone with an interest in public health. It also helps us to contribute to international health data. So this data actually allows us to compare how we are doing to other EU countries and indeed how other countries throughout the world are doing with some of these areas. So it's very important and helps us to meet our European and international responsibilities. The survey does take a snapshot of our nation's health and well-being, asking questions that focus on well-being and how we feel about our health, but also on chronic disease, on long-lasting illnesses, conditions and disabilities that might impact our lives. So what is it telling us this year? So in 2023, 80% of people report being in good or very good health. So this measure is down 2 points from 2022 and by another 2 from 2019. But while 36% of the population report having at least one long-standing condition or difficulty. So to put this in context, however, we know that from a European perspective, that Ireland has one of the highest rates of self-assessed health, and also we have one of the highest life expectancies in Europe. Our population is aging though, and with that we do actually expect an increase in chronic disease. And our goal is to try and reduce the effect of that by prevention, but also care close to home and appropriate care that can reduce the impact of chronic conditions on us as we age. We would like to keep it that way, and we will keep working on these strategies and policies and reforms that will support increased life expectancy, public health, prevention and well-being to the greatest possible extent in the years to come. Also, reducing the risks of antibiotic resistance is a key area of work for us in the department and in the HSE. As we know, this week is Antimicrobial Resistance Awareness Week. AMR, as it is known by its short abbreviated term, is one of the leading risks internationally, globally and in Europe. We know that it is one of the top 3 priorities within the EU Health Emergency Response Authority, and it is also one of the leading risks in our national risk assessment. So it is a very serious issue, and it's very important that we have data on that. So in this survey, 78% of people are aware that antibiotics kill bacteria, with 59% being aware that they do not kill viruses. So that may seem good, but actually it concerns me because nearly over 40% of people don't understand or realize that actually antibiotics do not kill viruses. They have no impact on them whatsoever. And we're entering into the winter season now where we're going to have a large amount of viruses circulating. So our best protection against viruses is our vaccine. So it's really important that we can reinforce that message over the winter at every opportunity. So awareness that antibiotics kill bacteria is unchanged. And it is important that we increase our awareness that it doesn't kill viruses. And that will help our use of antibiotics or overuse of antibiotics. And as a result, by reducing our consumption of antibiotics, it will help us in the fight against antimicrobial resistance or AMR. So it is really important. Medicines such as antibiotics are vital drugs that are used to treat infections and to save lives. We need antibiotics and we need effective antibiotics for us to help fight these infections. We have made significant progress delivering our second National Action Plan on Antimicrobial Resistance. And more recently, we have convened a One Health Oversight Committee, which also considers AMR as one of the elements of very important elements of One Health. But at the same time, we are existing in a landscape where resistance to last resort drugs has tripled in the EU since 2005. So this is a growing problem and we really do need to address it. We can also help reduce antimicrobial resistance further by actually preventing infections. And how do we prevent infections? By increasing our hygiene, our non-pharmaceutical interventions like washing our hands, It may seem like, it is a very small act, but actually it can have a significant impact in reduction of the spread of germs. And by reducing the spread of germs, we're actually reducing the requirement for treating infections. So we're preventing infections, and that's really where we want to be at our preventative level so that we actually don't need to use them at all. I'm also very happy to see the health service use is reported in this year's survey. This is essential report to us. It complements other data that we have through our HYPE database and also our PCRS database and all our other databases on our health service utilisation. About 3/4 of us have visited a GP in the last 12 months, with an average of 4 visits per person, while over a half of children have been to the GP in the last year, with an average of 2.4 visits per child. In terms of hospital and out-of-hours services, 16% had visited an emergency department, 4% had visited a minor injury unit, and 9% had visited an out-of-hours GP service. The proportion of people using health services is marginally higher than in previous years, and that's not unsurprising really when we consider how our population is changing. So overall, our population is increasing by 1% each year, so that's more people. Also, we know that our population is aging rapidly, and our aging population over the age of 65 is increasing by 4 to 5% every year. We also know that in comparison to the EU, our population over 75 increased by 28% from 2016 to 2022. And this is in comparison to an EU average of a growth rate of 3.4%. So we're one of the fastest aging countries in the EU. So as a result, we are experiencing increased pressure on our health system, which is not unsurprising. Our health services are therefore having to work harder every year and to provide the same services to increased number of people who need them. Therefore, we're continuously working to improve and expand our health services and supports. And what's really important in all of this is to help the population to try and prevent illness so that we need to use the health service less, so that we can empower ourselves to know what it is that makes us healthier. What are healthy lifestyles? How can we reduce our risk behaviours by eating a healthy diet, by quitting smoking, by reducing our alcohol intake, increasing our physical activities? These are all elements that actually can help us stay healthy, and also reduce our risk of chronic diseases. So it's really important that we continue to reinforce this message in all of our settings so that we can increase the health within our population. Because our health is not just about our access to the health system, it's about what we can do ourselves to keep ourselves healthy. So this survey is very important, and as I outlined at the very outset, data is really important. It helps us make evidence-based decisions, which are the type of decisions that policies are made. I would also like to add my thanks to the department and health sector colleagues, Ipsos Ireland, and of course our survey participants who made all of this possible. I'm happy to share with you much of the data reported here this morning, but it is all available on the CSO website. We will also be sharing data with researchers in the usual ways so they can also mine the data further and provide further insights with this data in collaboration with other big data sets or other bespoke pieces of research that can be commissioned alongside this. We will also be sharing data with researchers in the usual ways, as I said, and data files will be available through the ISDA, and for those who need more detail, application forms for an individual data sharing agreements with the department are available through our Healthy Ireland website. And I would encourage more research in all of these areas because it's through that emerging intelligence that we can actually identify areas for policy improvement. Finally, in relation to tobacco, alcohol and drug use, I would also really encourage anyone who is looking to quit smoking or substance use or to reduce alcohol consumption to access HSE's excellent supports in these areas. the Quish website, askaboutalcohol.ie and drugs.ie, and the HSE have put significant resources and efforts into developing these resources. And there is a significant use of these resources, but also we need to actually increase our targets and achieve further successes in these areas. The Healthy Ireland, Sport Ireland and HSE Healthy Eating Active Living websites are also excellent resources for the 90% of us who would like to make changes to improve our health and well-being. So in the short time available to me, I have only been able to scratch the surface of these survey findings for you. However, our colleague from Ipsos Ireland, Kieran O'Leary, will now present a more detailed analysis of the findings. And I would urge you all to take a copy of the report outside or access the results online and spend some time looking through the wealth of data available. Thank you all very much. Thank you.
Many thanks to our CMO and to our ministers this morning. We just take a quick 3-minute break just to allow everybody who needs to get back to the Dáil to do so. So thank you very much again. We're ready to get going again now. So the survey has many elements to it. There's the data collection and analysis, and that's a huge undertaking. So we owe a huge debt of gratitude to our partners in Ipsos BNA, who have undertaken all of this incredible amount of work for us over the last few years, since the survey started in 2015. So I would now like to introduce Kieran O'Leary from Ipsos BNA, who will go through the results in detail.
Okay, good morning, everyone. It's tough going forth because I feel the story has already been told. But I think here comes the science. I'm going to dig into some of the findings in a bit more detail than the previous speakers kind of give kind of top line level results. So sort of dig into some of the trends behind things and some of the groups within the population where some of this change and some of these learnings are coming from. So I suppose the context is, as Fiona mentioned, it's the ninth wave of the Healthy Ireland survey. So it's well established at this point. And over the various waves that we've conducted so far, initially face-to-face, up to the pandemic, since the pandemic, or during the pandemic, and since that period, telephone. We've spoken to over 50,000 people throughout Ireland about their health behaviours and their attitudes to various things. So if we haven't got to you yet, we'll get round to you eventually as we work our way through the population. So this wave, which was conducted between October of last year and April of this year, it gives us great insights, I think, into some key changes in our health behaviours. I suppose as our lives continue to adjust to what's become the new normal. And as I think with so many other parts of our lives, many of our health behaviours, but not all of them, many of them continue to readjust back to where they were before the pandemic started. Everyone has sort of thanked different groups, and before I kind of get into some of the results, I want to thank two particular groups that are really instrumental to the success of the survey. The first is the Ipsos B&A Public Health Interviewing Team, who've worked on this survey since we started interviewing on this back in 2014, and their flexibility and experience allowed it to evolve over that time and to engage with the population and engage with them often on quite difficult subject matters and quite difficult things to conduct surveys about, to ensure that we can get robust, accurate and meaningful data. And also, of course, to those, on this occasion, 7,411, every single one of them is important, to all those people across all communities in Ireland who gave generously of their time to participate in the survey, and when they were selected to participate, responded very enthusiastically and honestly to provide detailed information about various aspects of their health behaviours. So the report published today gives a good overview of health behaviours in Ireland today and how they have evolved over the past decade or so. It shows that change, and we can see quite a lot of change in our health behaviours over time. But change, and meaningful change in particular, is slow. So we shouldn't expect to see dramatic changes between one wave and the next, and nor do we, as you've seen from some of the trends that have been presented so far. One of the key benefits, as others have alluded to, is that each wave gives us an opportunity to explore a wider range of health behaviours, as well as getting more depth on some more established ones that we track on a year-to-year basis. So things like general health, smoking, alcohol, health service utilisation, all of which have been spoken about this morning. The 2023 survey, it gives some new data on new areas that we haven't looked at before, certainly on this survey. It gives data on drug prevalence, which has been mentioned, and some of the information on sources of risks of information about harmful alcohol consumption. We also go back and look at some of the things that we looked at before to see how they've changed. Mental well-being, social connectedness and antibiotics being three of those areas, as well as continuing our development of a very robust data series on suicide and suicide awareness. Now, I haven't got much time to talk through them all. I don't want to go into too much data this morning. So I'm going to talk through a few of the areas, many of which have kind of been mentioned already, but hopefully I've got a slightly different take maybe, or a different angle on things. So firstly, I suppose looking at smoking, and as we can see, I think this is a very impressive slide, that the smoking rates have fallen very, very considerably since we first measured them back in 2015. Back then, 23%, not far off a quarter of the population were smokers. Now it's down to 18%. So that's probably around about 150,000 fewer people smoking today than there were only 8 years ago. So it's really encouraging development towards eliminating tobacco in our society. And particularly encouraging, I think, we kind of see it kind of flatlined. You look 2019 to 2023, not much has changed following a few years of reduction. And I think that's quite encouraging. Not in face of all the pressures that we got from that pandemic period, all of the changing behaviours and habits and how our lives were changing, and smoking prevalence remained unchanged over that period. So despite that was always going on, and might have been easy for people to slip back into old habits in terms of what was going on. So I think that's encouraging. The other thing that's encouraging is another aspect that is unchanged, which is the desire to quit. And smokers, since we started measuring this, we've seen this. Smokers want to quit. About half of all people who smoked in the past year have at least tried to quit at some point, and a quarter of them have been successful. So, there's real opportunity. People are trying to make that step. So there's a real great opportunity, as there always has been to encourage positive behavior change in that sense. Even though every attempt to quit isn't successful, many are successful after perhaps repeated attempts. And that's really true. As we've seen over the past few waves, there's more ex-smokers in Ireland now than there are current smokers. So people are making that step. And of course, anyone who's tried to quit smoking or successful or unsuccessful, no, it's not an easy task. It's not something that's easy to do. But what we can see is that smokers, that the importance of willpower in this, and we can see an increasing proportion of quitters, about 2/3 now, are saying that they've quit through willpower alone, not needing to use any of the devices or whatever to help them quit. Of course, encouraging people to stop smoking is only part of the solution. One of the big challenges, we need to stop people from smoking in the first place. And that does remain a challenge as we dig into this and to look at some of the age groups around this as well. We can really see the challenge within this. If we look at the youngest group in the population that we include on this survey, the 15 to 24-year-olds, we see the smoking rates in that group. They're not that difficult from older people. So, smokers are still being recruited in that group. People are still starting to smoke, and that's a key challenge. And that immediately, of course, brings to mind vaping and e-cigarettes, which, of course, are very topical at the moment. As mentioned earlier, around about 8% of the population now use e-cigarettes on a regular basis. But when we dig into the younger people, we can really see where the challenge is. And we can see that usage of e-cigarettes among that youngest age group, it's about twice as high as it is in the population overall. If we look at women, so if we look at women aged between 15 and 24, about 1 in 5 of them use e-cigarettes either daily or occasionally. And men, it's not that far off. It's a little bit lower, but not that much. So the long-term health impacts of vaping and so on might be unclear, but certainly the challenge it's presenting for young people in Ireland today, that's very clear, and there's a growing number, of course, using such devices. Looking at alcohol consumption then, drinking behaviours have changed radically over the past number of years. And of course, we went through the pandemic period when pubs and other venues and so on were closed, and drinking at home became perhaps more common than it ever was before. This survey gives us the first full wave where pandemic restrictions, or the first full wave in a few years, obviously, where pandemic restrictions have been removed and normal life in terms of socializing has been present throughout the entire survey fieldwork period. So really, what does that mean in terms of the most Irish of, I suppose, most social of Irish behaviours, which is alcohol consumption? What we can see is that alcohol consumption is in decline. Fewer people compared to pre-pandemic are reporting having consumed alcohol, both in the past 12 months. And also, if we look at people who drink at least once a week, those numbers are those proportions are falling anyway. And we can see, as life returns to normal, we can see drinking multiple times each week remains very slightly lower than it was in 2019. So there's definitely change there. Come and look at particularly harmful drinking, so binge drinking, so 6 or more standard drinks on a typical drinking occasion. That's also a little bit lower than it was before we measured the pandemic. So 27 and 24, as you can see on the slide there. So around about a quarter of the population are binge drinkers. But of course, as with all these things, it's clustered. It's more likely to be clustered in certain groups than in others. Men, and young men in particular, we can see are much more likely than others to binge drink. Around about half of men aged between 15 and 24 binge drink on a typical drinking occasion, compared to around a quarter of women in that age group. But there's also encouraging news among young people, albeit a slightly older group, maybe those into their late 20s, early 30s, that we can start to see perhaps some evidence around positive change in drinking behaviours. We can see that group is drinking less frequently than they were before the pandemic. It's probably a slightly different group because obviously people have moved out of that group and others have moved in. So we can see that that they're drinking a little bit less frequently than they were before. So a very positive change in that sense. Perhaps, and we can see it in evidence in other work and other surveys that we do, we can see broader kind of lifestyle changes in that age group. There's a greater focus on positive health and well-being among people in that age. And that's something we're going to, of course, continue to monitor in further waves of this survey. In alcohol, as mentioned, we obviously bolt on additional waves. or additional modules each wave. And on alcohol this time, we looked at health messaging and information relating to alcohol in advance of legislative changes, of course, that are coming up in that area. Now, this is always a challenging thing to measure, and behaviour suggests that our ability to kind of seek out information and see information in a crowded environment, such as when we're shopping or seeing advertising or so on, it's very, very difficult and it's quite limited. And probably in that sense, it's probably not that surprising that such a small proportion, around about 12%, report often or always seeing health messages when looking at alcohol packaging, and just over half of drinkers say they never see health messages. Now, obviously, the amount of health messaging is quite limited in alcohol at the moment. So there is great opportunity there, and like communicating information and health information through packaging and advertising is, as we know, is very, very challenging. But when done well, as we've seen with cigarettes, for example, it can be highly impactful. So it's undoubtedly a topic we'll be back to look at this and to see what role health warnings play in ensuring drinkers make informed decisions about safe levels of alcohol consumption. The CMO shared this slide. This year's survey gives us up-to-date data on health service utilisation through GP usage, and also we look at in the report as well some other health professionals among both adults and children. And there's a section in the report this time as well looking at a kind of more detailed analysis of longer-term trends in health service utilisation. So as we can see, so despite a blip there, which you'd expect in 2021 during the pandemic, the longer-term trend in GP visits is increasing. So 76% of the adult population say they visited a GP in the past 12 months. That compares to 73% in 2019. Go all the way back to 2015, it was 71%. So that's certainly increasing. So more people are visiting their GP. That's, of course, welcomed particularly in terms of earlier diagnosis of potential health problems. But obviously it comes at the cost as well of increased GP workload and perhaps arguably longer waiting times for patients and those wanting to see the GP. And of course, we have to recognise, as noted already, the population, of course, is getting larger. So this is a larger percentage of a larger number of people. But what we can see is a lot of this growth is coming from, in terms of the proportions-wise, is coming from younger people. So we can see that while, if we look back a few years and compare it to now, the proportion of over 65s who visit a GP, which is very high anyway, naturally, remains pretty much unchanged. It's amongst that slightly younger group, the under 65s, where we can see that growth in GP usage coming from. So that group in the population engaging with their GPs perhaps more than they did before. Also, if we look into it, we can see the growth is coming from within private patients rather than those with medical cards or GP visit cards. The proportion of them doing so remains pretty stable over that period. Of course, lots of those are over 65. So perhaps more people engaging with their GP, but we can see the average frequency, the average number of visits there, you can see drop back a little bit over time, and perhaps suggesting that those who are coming into GPs now are perhaps doing so slightly less frequently than those who are coming all the time. We also, as I mentioned, looked at GP usage among children of the survey respondent, and that repeats a module of 20 that we did in 2019. So it gives us a flavour in terms of what's happening amongst children across all age groups. So if we look at children as a whole, so anyone under the age of 18, we can see, perhaps to be expected, we can see less frequent GP visits among children, both when we compare it to adults and also when we compare it to when we measured it back in 2019. So just over half, 55% of children who were identified through the survey had attended a GP during the previous 12 months. The average number of visits a little bit lower as well, around about 2.4 per year. We can see obviously differences. We can look at it by age, and we can see that obviously it's a little bit higher amongst younger children. About 3/4 of under 6s have attended a GP, compared to around about half of 6 to 11-year-olds. And in both cases, they've declined also since we last measured it in 2019. The CMO spent a bit of time talking about antibiotics and antibiotic usage and understanding of antibiotics. This is something we've measured a couple of times, showing some quite interesting trends, I think. So what we see is that antibiotic usage, we measured it both before, pre-pandemic and during the pandemic. We saw a decline over that period in terms of the proportion of people who'd taken antibiotics within the previous 12 months. That probably relates to a number of factors. There was COVID-19 restrictions in place, so infections weren't spreading as much. People weren't going to GPs perhaps as much as they were. But as life returns to normal, we can see that antibiotic usage has returned to pretty much where it was before. And this aligns with trends. We can see data from the Health Protection Surveillance Centre, looks at consumption in primary care, and it shows a decline over the pandemic period, but usage now back to pre-pandemic levels, which we're seeing there. It's pretty much, if you look at in population groups, there's no real change. Every group, every age group, gender, they all kind of follow the same pattern, a decline and a subsequent increase over the course of this time period. The one exception is we can see a slight change. We can see women aged 75 and older less likely now to have taken an antibiotic than previously, while men in that age group a little bit more likely. So that's a factor within that to keep an eye on. As the CMO spent quite a bit of time talking about, we need to consider these results in the context of overuse and incorrect usage of antibiotics. And of course, they're one of the main factors behind the growing resistance of many bugs out there to traditional treatments. In this respect, you can see it's, if we take a balance, it's encouraging in some ways that the correct understanding of antibiotics is increasing. Over 3/4 correctly identified the antibiotics kill bacteria, and 60% correctly disagree that antibiotics kill viruses. Both are higher than we last measured them in 2017, or when we measured them in 2017, so we can see increases in that. But of course, as the CMO noted, there are large groups in the population out there who have incorrect understanding about antibiotics. So that's a particular challenge there, both in terms of increasing understanding and also in the ambition of reducing antibiotic usage generally within the population. Illegal drug usage, and this is the first time we've looked at this on the Healthy Ireland survey. So we looked at drug prevalence, both illegal drugs and also then usage of sedatives and tranquilizers. It was an optional module on the survey, which is often the case, and we introduce some of these more sensitive modules or more specific modules. Suicide, similar, the data we published there is an optional module. But what we typically see is we see quite a high uptake amongst participants, and it's encouraging that of everyone who took part in the survey, 85% went on to complete the module that we gave them on drug usage. So what we did here is we tried to reflect previous studies that have been done. So we asked respondents about their lifetime usage of each drug. And for each drug that they say that they've used during their lifetime, we ask them whether they used it in the past month, past year, or longer ago. So it gives us prevalence measurements then, similar to other studies. So lifetime, last year, and last month, which is the way these are often measured. If we look at what it shows, it gives us about 21% report lifetime illegal drug usage, 7% past year, and 3% past month. Interesting, if you look back to the study that a lot of this was based on, which is the 2019-2020 Irish National Drug and Alcohol Survey, the figures are broadly aligned to that. Obviously, time has moved on a bit since then, but the figures are fairly closely aligned. The patterns are pretty much the same. So that's encouraging, that sense, in terms of giving us strong data in this area. Cannabis, unsurprisingly perhaps, is the most commonly used illegal drug. 20% have used it at some point during their life. 6% have used it during the past year, and 3% have used it during the past month. Unsurprisingly, as is the case with many other illegal drugs, it's most likely to be used by younger people. And we can see 1/3 of under 25s say they've used cannabis at some point during their life, and also men more likely as well. So roughly about 1/4 of men say that they've used cannabis at some point. We also looked at legal drug usage, so sedatives and tranquilizers. So 13% say they've used sedatives or tranquilizers in the past, or have used them at some point. 7% during the past year, and 4% during the previous month. Differences here, unlike illegal drugs, we can dig into we can dig into certain population groups, and unlike illegal drugs, which were more likely to be used by men, sedatives and tranquilizers more likely to be used by women. And if we look at women aged over 65, 14% of women aged over 65 say they use sedatives or tranquilizers within the past year. And, you know, we also went on and asked about if they're using them, you know, in terms of prescribed or unprescribed, and 9 out of 10 people who've used them say that the drugs that they use were all prescribed to them. So that, I suppose, it gives you a kind of short overview and a bit more depth on some of the things that some of the earlier speakers spoke about. There hasn't been an opportunity to go into some of the other areas, but they've been covered, I think, in quite a lot of detail by some of the other speakers. Some of the general health, the declining perceptions of self-reported general positive health, mental health, where we know that there's particular challenges, and also then some of the results on suicide, which are presented and are in the report today. Obviously, this is the start of this process, as it always is with the as we publish the summary report. More and more data will become available over time, will become available to researchers to explore in different ways and find other nuggets and stories within the data. We're underway with the 10th wave of the survey already. Fieldwork has been ongoing now for around about 2 months, and the survey, of course, continues to evolve, and I look forward to being back here next year to give further update on key trends in some of the areas we've spoken about there: smoking, health service utilisation, alcohol consumption, and so on, but also some new areas that we're revisiting on this survey as well. So measurements of overweight and obesity, a key measurement, and also then modules looking at things like physical activity, diet, nutrition, and also sleep. So thank you.
Kieran, thank you so much for, as usual, your wonderful and comprehensive run through of the survey data for this year. I'd also like to take this opportunity to say a huge thank you to yourself and your colleagues in Ipsos, Jess and the others, and also a huge thank you to our colleagues in Stats and Analytics, Michael, Nasson, Pauline and the team for your help. There's a really good reason why I have you guys all on speed dial. So thanks a million again for all of your hard work, patience and flexibility in working together to keep the survey running and to get it launched every year. We're now happy to take some questions from the floor. So if anybody has any questions for Kieran, we should have a mic available if anybody would like to ask a question.
Hi, thanks, Kieran. Could I ask a question about your methodology? I noticed in the 2021 survey you tried to collect air codes from respondents. It was the first telephone interview. And I think you say in the notes that about half of people either didn't know or didn't want to provide one. Are there any plans to revisit that in future waves?
It's not unique to this survey. We see it across all survey work we do. It's quite challenging, I think, with air codes at the moment. Maybe it'll get better over time. I think for some people there's an unwillingness to give their air code, and because obviously it identifies them more. So, you know, with an anonymous telephone survey, it now identifies them to their address and it gives a bit more information. So I'm willing to do that. But also for lots of people, and we see this across some groups, and particularly in urban areas, is there's still lots of people who don't know their air code. So that's a key challenge. So we tried it in a couple of different ways in terms of trying to get particular parts of the air code and whether people can give us the first few digits or not, but we haven't found an approach that works successfully at the moment in terms of getting that information from people. So we try to work around with that. Hopefully it's something that will improve with time as people become more and more familiar with air codes and using air codes. That's still a particular challenge.
Thanks very much. I just noticed in this year's report that most of the outcomes are reported by age and gender, but there isn't a routine reporting by any socioeconomic variables. And I thought that maybe differed from previous reporting in the summary report. So my question is there any plans to produce a report on the health inequalities through the survey report?
It links into the previous question, I think, as well. And one of the reasons that, one of the reasons we would have taken air codes in the telephone survey is obviously links someone to a particular geographic area, a small area within the country. Back when we were doing the survey face to face, it was easy to get that information because, of course, we're standing on the doorstep. We know where they live, we know where they are, and the interviewer can record exactly where that was. And that information then was used to assign people to particular areas. So then we can do deprivation coding, and we can look at socioeconomic differences between people. So that's one of the limitations of the telephone, is that we can't get to that. There's other gradients, of course, we can look at because and it's all within the data. So we can look. Obviously, we have education, we've got employment, we've got things like that. So we can dig into that. But in terms of looking at deprivation, which was what we traditionally looked at in this, that's what we're limited on, it being a telephone survey and people not giving us air codes.
Any other questions? Helen?
I'm taking advantage of the quietness in the room a little bit, but I noticed on the opening section of the findings there relating to self-rated health that the largest deterioration in self-rated health was among women aged 55 to 64, I think was the age group that seemed to be more significant than in the general population. And I'm just wondering, do you have any idea at this time what's underpinning that? Is that a mental health picture, or is that cost of living, or do we know why that particular group may have seen a more steep decline in self-rated health over time?
Yeah, your answer is as good as any I could, or your speculation could be as any as I could give. It's always a very difficult figure to interpret because there's so much going on. It being self-reported, so we obviously don't have a absolute measure in terms of whether they are actually in good health or not. I think with the change we've seen over the past few years in terms of COVID and so on, people are perhaps more in tune with their health. Maybe obviously we've got increasing pressures in terms of people, when we ask people about their health, maybe 10 years ago they focused on their physical health. Now maybe more so focusing on mental health in addition to physical health. So the different roles of that. So it's so much has changed, and it is affecting that group more than others. As to why, the survey doesn't go into that detail, so we can only hypothesize. And I think your speculation's as good as anything I'd come up with on that front.
Hi, thank you for presenting the summary report. It was really useful. Just one question about alcohol consumption. It was mentioned in the speeches about the change in behaviour, but were the respondents asked whether they drank in pubs or other venues or at home?
Not on this wave. We have done it in other waves during the pandemic in particular to look at the how things have evolved in terms of where people were drinking, look at the changes within that. But on this current wave, no, we don't have that. So what we did see is, of course, an increase, that there was obviously a lot more drinking at home, and we were able to look at in previous data sets, look at differences in drinking behaviour of those who drink at home versus those who drink elsewhere, and in company versus not in company.
Okay. And is it included in the next wave under diet or nutrition?
We don't know drinking location. We don't have in the next wave. It's not so diet and nutrition focusing more on dietary behaviour, snacking, healthy food consumption.
So maybe for 2025 then.
Not my decision.
Any other questions? Just quickly to add, just in response to that last question, we typically, just for departmental colleagues and those in state agencies and researchers and so on, we typically send around an invite to departmental colleagues to make submissions for questions into the Healthy Ireland survey in sort of February, March, April every year. So at that point, if you have any sort of questions that you feel the survey to date hasn't been answering, or you'd like modules repeating or anything like that, get in contact with someone in the department who can make a submission and a business case on your behalf. And a huge thank you also to those members of the advisory group who are present today. Your work in terms of determining the priorities of of those submissions and working out what goes into the survey and what we need to find out about as a priority is very much appreciated as well. Just a quick note for researchers as well, just to say that we will be submitting, within the next few weeks, we will be submitting the data files for this wave of the survey to the Irish Social Science Data Archive, also known as ISDA, and tables should be available through the CSO website this week. Many thanks to Nasant and Michael for all their hard work in putting those up on the CSO website. We also have the report and a summary of the results available on the Healthy Ireland website should anybody need to access it. For anyone whose questions we didn't get to answer today in the Q&A, if you have any follow-up queries, please do reach out to us either through the department's press office or through Healthy Ireland at health.gov.ie, and we'll try to make sure that we get any questions answered over that amount of time. And I'd just like to say a huge thank you again to all speakers, colleagues, the technical team, everybody in Ipsos BNA, and last but not least, those who agreed to be interviewed for the survey. Without your hard work, this would not be possible, and it's a hugely valuable support for our policies and how we work to take care of the health of the population. It's really brilliant to have this resource, and thank you all so much. I think I bring the formal part of this launch to a close now, but do please feel free to help yourselves to refreshments and have a chat, because I think we have the room for another hour or so. Thank you very much.